How's this?
That's great.
All right?
Good.
Good. The first thing I would like to do is to congratulate people that are in this room today. A lot of people here were probably in denial, still are. I heard a lot of people coming in and they were asked, as everyone was, are you diabetic? And some of them said, no, I'm pre-diabetic. Well, you're diabetic. And the sooner you confront that, the better off you're going to be. And Dr. Tom and Stephanie have certainly opened my eyes to the denial that I had. And this goes back for many years. I think I'm like 5.5 months into the program right now. And when I look back at my life and the issues, the health issues that I've had, I can now contribute to things that I've learned about through working with the doctor's chain, rather than things that my doctors following standard protocol had suggested might cause it. So all of this stress over the years, without getting into real specifics, has led me to, in the early 70s, having digestive issues, having issues of acid reflux, being on medication like Nexium was one that I was on for a long time, and until just recently continued to be on those medicines all the way back from the early 70s. 13 years ago, my wife and I were out jogging, and I had a heart attack. I'd never had any indication whatsoever that I had plaque buildup or high blood pressure or any of the things that are normally attributed to causing a heart attack. So when that happened, the standard protocol was to put me on blood thinners, to put me on statin drugs, and then 6 years ago I was diagnosed as type 2 diabetic. They used the term pre-diabetic, but I was diabetic. And they put me on metformin, then they put me on lisinopril, which is a blood pressure medicine to protect my kidney, and all the normal things. And the more medicines they added, and the higher their prescription, the worse I got. So the last prescription that I was given was about 6 months ago, and it was the 8th or 9th prescription that I would be taking on more than a daily basis. And Medicare told me they weren't going to pay for it, and it was like $900 a month. And I said to myself, so you need to get out of denial, and you need to take control of your own health. And it wasn't 2 days later that I'm on my way to one of my meetings in Washington, and I hear on 99.1 the advertisement for the doctor's chain. So I said to myself, I'm going to go to a luncheon. It was like this, but it was in Annapolis. And when I got home, I told my wife that this is what I wanted to do. So we had our first meeting, and I'm going to slip this off for a second. We had our first meeting in Dr. Steff's office, and I decided that before I committed to this, that I was actually going to start a little early and try and lose some weight. But I also wanted to look svelte, and I was going to wear my favorite sport jacket, which is part silk and part wool, and I have just loved this jacket and refused to give it up. But what I think I'm going to do is to turn it into a double-breasted jacket so that I can keep it. I used to wear a 42. This is a 36. And I was 220 pounds when I first walked into Steph's office, and I'm about 184 today. These people that you've heard these testimonies from, in my opinion, are pretty healthy. When I came into her office, my hemoglobin AC1 was 10.9. Are these new? And today, 5.5 months later, it's 6.4. I never considered myself as having high blood pressure. The reason I was on medication, I was told, was primarily to protect my kidneys from the diabetes medicine. And however, when I would take my blood pressure, at times it could be 130, 140 over 80 or worse. Today, my guess is that it's probably 115 over 64 maybe. 112 to 120 max over 70 is where it seems to be my range. When I take my blood sugar test several times a day, it'll range from 98 to 120-ish max. I've been finding it closer to 98 to 110, which is evidenced by the drastically lower hemoglobin AC1 numbers here. What other?
How much medication?
Oh yeah, all this medication that I have had over the years. For the last, I'm going to say, at least 2.5 months, I haven't been on anything. The old GERD medicine for reflux, I no longer take that.